Welcome to TRINITYMED TV. We are glad to have you here. Thank you for checking out our channel. In today's episode of Medical Tips, we shall be talking briefly about medical tips on how to improve infertility. So many young couples who are finding it difficult to conceive are always concerned about this particular topic, infertility. So in this video, we shall be discussing briefly on how to improve your fertility. Do well to listen attentively and concentrate so that you can gain one or two things in this video. Over the years, I've seen couples walking up to me for counseling and treatment of infertility, but the fact still remains that infertility treatment sometimes only requires a little effort from both couples, and by following strictly the advice given to you by your healthcare provider. Before diving into medical tips on how to improve your fertility, it is important we talk about what infertility is all about. But then, we will not be going too deep on infertility. Briefly, we'll just talk about the meaning of infertility because this video is basically on medical tips on how to improve fertility. So, what is infertility? For infertility is a failure of couples to achieve a pregnancy after 12 months or more of regular unprotected sexual intercourse. And you should know that infertility affects both male and female. So in order to achieve pregnancy, it is important that both male and female work hands in hands in order to achieve their pregnancy in no distance time. So in this video, I'll be dishing out medical tips on how to improve your fertility. Please stay tuned. Firstly, you have to eat more food that are rich in zinc. And common sources of zinc are oysters, all kinds of seafood, nuts, whole grains, dairy products, and pumpkin. What is the function of zinc to fertility? Now, zinc helps to improve sperm quality and motility. It also increases the sperm density. While in females, it helps to support the regulation of menstrual cycle by nourishing healthy ovarian follicles and maturing oocytes, thus promoting ovulation. Secondly, eat more food that are rich in vitamin E, and you can get this from white gem oil. Vitamin E is a good source of antioxidant, and it helps in reducing free radicals of the body. It may also help to reduce oxidative stress, which can impact egg quality and sperm motility, thus improving chances of conceiving. Another thing you should consider is by consuming more of fiber, fruits, and vegetables. Not taking enough fiber, fruits, and vegetables might increase the chances of polycystic ovarian syndrome. Another thing you should consider is by avoiding trans fat. Trans fat increases the risk of infertility in women. This is due to their negative effect on insulin sensitivity. Research shows that food that contains trans fat is directly linked with infertility for women. Examples of this trans fat can be found in fried food, cakes, pizza, pastries, cookies. All these might be tasty, but don't take them. Another point in improving your fertility is to do more of meditation. Avoid stress and tension. Get enough rest and relax your mind. Another thing you need to consider is by having sex regularly. Every day or every other day. Ensure you track your ovulation. Have sex during your ovulation or near your ovulation. If having sex every day is not possible or enjoyable, then you have to consider having sex 2 or 3 times a week, starting soon after the end of your period. This can help to ensure that you have sex when you are most fertile. How to know when you are ovulating? In an average 28-day menstrual cycle, ovulation typically occurs about 14 days before the start of the next menstrual period. However, each person's cycle's length may be different, and the time between ovulation and the start of the next menstrual period might vary. If, like many people, you don't have a perfect 28-day menstrual cycle, you can determine the length and midpoint of your cycle by keeping a menstrual calendar. What are the signs you can see when you are in your ovulation period? 1. There will be change in vaginal secretions, that is, cervical mucus, just before or during ovulation. You might notice an increase in clear, wet, and stretchy vaginal secretions, while just after ovulation, cervical mucus decreases and becomes thicker, cloudy, and less noticeable. Another sign is change in basal body temperature. It increases slightly during ovulation. So then, you must ensure you keep check of your temperature if you want to use this method to know when you are ovulating. Another point is to avoid intake of alcohol and avoid smoking. Also, for those who complain of sperm spill after coitus, it is important to know that you only need one semen to fertilize an ovum. All the ejaculate cannot find their way up. But then, if you are still worried, ensure the following steps. Lie still at least 10 to 15 minutes after coitus. Secondly, probe your pelvis, that is, tuck pillow under your hips after coitus, so that the gravity can move semen toward your uterus. Third, put leg up. Rest with your leg up a wall. Another point is to maintain a healthy weight. Then take prenatal vitamins. And lastly, on this episode of medical tips on how to improve fertility, you must ensure you get tested so that you be sure where the problem is coming from. Both spouses are advised to always work together to achieve their pregnancy in no distant time. Then also ensure you talk with your doctor